Hello, my name is Tom Abbott. I'm a junior anaesthetist and a researcher at the William Harvey Research Institute, Queen Mary, University of London in the UK. This is a short video about our paper with the International Surgical Outcome Study Group on grading the severity of post-operative complications in global health research. It's fundamental to any epidemiological research to be able to reliably identify the outcome of interest. In most surgical and perioperative medicine research, this is usually post-operative complications. One of the most common methods for grading the severity of post-operative complications is the Clavien-Dindo grading system, which uses the treatment for any given complication to grade the severity of that complication. However, it's unclear how this may compare internationally, particularly when considering high-income countries compared to low or middle-income countries, where the treatment for a particular complication may differ. Therefore, we undertook a secondary analysis of the International Surgical Outcome Study, or ISOS, cohort, to look into this further. The International Surgical Outcome Study was a 7-day cohort study in 19 high-income countries and 8 low or middle-income countries. We graded the severity of complications using two methods. Firstly, the Clavien-Dindo grading system, and secondly, a simpler and novel ISOS grading system, which categorized complications as mild, moderate, or severe according to the judgment of the clinician involved. We compared the grading of complications between the ISOS system and the Clavien-Dindo system using the intra-class correlation coefficient, where zero agreement between the two systems is represented as a 0, and complete or total agreement between the systems is represented as a 1. We presented 95% confidence intervals for these values. The International Surgical Outcome Study, or ISOS study, recruited 44,814 patients, of which around 7,000 sustained at least one complication, and in total there were around 11,000 post-operative complications that we used in our analysis. When we compared complications graded according to the Clavien-Dindo system with the ISOS grading system, we found poor agreement between the classification systems with an intra-class correlation coefficient of less than 0.5. When we undertook a secondary analysis looking individually at complications from centres in high-income countries, we again found poor agreement, and in lower middle-income countries we again found poor agreement. In summary, when comparing the Clavien-Dindo grading system with the ISOS severity grading system, we found poor agreement using the intra-class correlation coefficient, and we would urge caution when using systems which use the treatment for any complication to grade the severity, particularly in the context of global health research in low and middle income countries. Thank you.